I want to thank you all for your testimony. We'll now proceed to the question and answer session, and I will first begin. Dr. Whaley, in my opening statement, I referenced analysis citing less than 25% of hospitals are currently complying with the price transparency rules, and you noted that as well in your testimony. In your research, what response have you seen from hospitals complying or more likely not complying with the price transparency rules and regulations we already have in place?
Thank you, Chairman Smith. As I noted in my opening testimony, there have been audits of price transparency postings that have noted that roughly 25% of hospitals are actually compliant, meaning that 75-ish% of hospitals are actually not complying with these requirements. As I also noted in my opening testimony, I think there are important federal actions that could be done to improve compliance.
Mr. Short, we have armed Americans with patient-first health accounts, such as HSAs, and then told them to go out into a world where they struggle to find out what their care will actually cost. That's a little like giving a gift card to someone and sending them to a store with no price tags on the clothing. Given your work on HSAs in particular, how will more price transparency enhance the benefits of such health savings accounts?
And speaking for over the 1 million American families that Ameriflex has helped, efficiently spend their health care dollars to get the care that they need, the 30 million HSA accounts that are currently in market, and the additional 35 million tax advantage accounts, FSAs and HRAs, by opening up more price transparency options, we can make them more powerful consumers in terms of looking for care and being able to get the care that they need at an efficient price below the deductibles beyond items that wouldn't be covered by catastrophic insurance.
Ms. Troiano, price transparency is critical not just because patients have a right to know, but also because it disrupts the regular payment and insurance models, encouraging competition and therefore lowering cost. How have you seen price transparency lower cost for your small business and its employees?
It has lowered first of all, let me make it clear that our premiums did not lower this year. Our premiums were originally came back at 35%. With sidecar, they were 10% higher. So our premiums did not lower. 10% was the palatable amount that we could take in. 35% was not, and there were several companies that refused to even bid on our business because we are small and we had big claims. So the savings that we're seeing is for our employees, which was more important to us than making sure that our savings were there. And what we're seeing is a person whose spouse had back fusion surgery that would have been $160,000 and ended up being about $80,000. We see our employees are able to go to any pharmacy, so they can use Mark Cuban's Cost Plus Pharmacy. They're saving a lot of money through that. Single Care, which is an app, GoodRx, which is an app, and they do not have that money. They're not outputting money up front. Sidecar puts the money out up front, and all the prescriptions are paid for.
Dr. Pinecki, you run an outpatient surgery center that has employed transparent upfront pricing for patients. How have your patients reacted to confidently knowing the price they will pay for their procedure?
It's been super encouraging for me. One of the reasons why I did it and probably what fuels me moving forward, I understood that employers were actively pursuing value, quality, and price, defining value as quality and price in their care for their employees. So I knew that was going to be a likely participant for our business. But what's been really interesting is there's been folks that have actually been shopping for care. So they've actually been online. We actually receive a fair number of patients. I mentioned the patient from Nebraska. We've had a patient travel from the Upper Peninsula of Michigan for colonoscopy. That's a relatively low-priced procedure compared to a joint replacement or some of these larger surgeries we do. And so the feedback that I get from them has been super encouraging. They said, hey, I've looked around, I've called around, the hospital was this price. We called the neighboring city, the hospital's that price. We're willing to travel 10 hours to come here to receive a bundled price that we knew was exactly what the cost is going to be. There's no balance billing or a la carte billing outside of that. So it's been super encouraging.
Mr. Campine, as we look at the price transparency rules for hospitals and health insurers, we need to ensure that the public data is actually usable for patients. Given your experience running Healthcare Blue Book, what are the current rules, limitations, and how can we enhance the usability of pricing information for the individual patient?
Sure. I'll start on the the hospital side first. First of all, we need compliance, right? And second is the files, when you've seen one, you've seen one. So we need some standardization in terms of the values that are in those files. On the hospital side, it's 300 services. You know, reasonable coverage, only 70 of which, if I'm remembering correctly, are standardized and required. And you're looking, in most instances, at the facility piece of the charge, right? So we don't know what the anesthesia is necessarily, or the doctor, if the doctor is not affiliated with the hospital. So it's really helpful, right? When we think about consumers and how we present prices, it's in the context of an encounter. Everything you need to know about the cost of that service for the day that you go in. This is what is so great about the surgery center and the bundled pricing. You know these things. Secondly, so much care is moving into the outpatient environment. Generally speaking, right, the HOPD, or the hospital outpatient department, is the most costly alternative in terms of site of care for something like an ACL repair. So today you only look and can compare, let's say, for example, across the lowest cost among the most expensive provider type. So you really need to have all of that information. What do the independent ASCs charge? What is their price? What is the total price with everything combined? How do you compare that with the hospital? So I think those are some of the ways that one can improve that data and make it more usable. Of course, that's our job, right, at Blue Book, is to do things like that, but those are some of the gaps. We're a little bit earlier, right, on these carrier files. As Chris had alluded, these are enormous files. We'll get better at it. We like these problems. But we already know that the data, the file formats, again, when you've seen one, you've seen one. So it takes a ton of time to load them, clean them. There are what we generally refer to as zombie codes in this, where every provider is given a price despite the fact that those providers may not actually perform that service. That's not helpful to anybody. And importantly, there needs to be some sort of check. We sit in sort of a unique position in that we are a large aggregator of claims data. Adjudicated medical claims data, think of as an itemized receipt. You know what was actually paid according to that contract on those services, and you can compare it to what is being reported in the rate files. The rate files are just the contract files. Remember, rates have to be run through an adjudication system before you know what the receipt looks like. Again, early stages there, but I think we'll probably get better and better at aligning those two.
Thank you.